Well, it makes sense to develop a vaccine for something you don't even understand, right? I'll let you be the judge of that. In the last couple of videos, this series, we have covered strep research in depth and if strep has actually been shown to be the true cause of any disease. We also looked at if antibiotics are really helpful in stopping the progression to rheumatic heart disease. This is really why many parents take antibiotics or take the prescription of the antibiotics for their kids when their child has been told that they have strep throat. They worry that it will spread to the heart. This video will go deeper into what rheumatic heart disease is and what we've been told. Let's jump in. Now, according to the mainstream story, the most common presenting features of rheumatic fever are fever and arthritis. But the most serious manifestation is carditis because it can lead to chronic rheumatic heart disease. According to a 2018 systematic review in The Lancet, they write, acute rheumatic fever is caused by an autoimmune response to a throat infection with strep. Cardiac involvement during acute rheumatic fever can result in heart failure and premature death. Poverty and household crowding are associated with rheumatic heart disease, both of which remain a problem in many low-income countries. Here's the thing though, and according to all the research on this, rheumatic fever and heart disease has now almost completely disappeared in most developed countries, including the US. But only really it remains a problem in other areas of the world where poverty remains. This review points that out. Among populations safeguarded by high standards of living, rheumatic heart disease rates are virtually zero. This dramatic contrast highlights the influence of environmental, economic, social, and behavioral conditions on the risk of group A strep infection and progression to acute rheumatic fever and rheumatic heart disease. So even in the medical literature, they have repeatedly recognized that rheumatic fever and the resulting heart disease that can accompany it are associated strongly with poverty. By the way, its decline in wealthier countries came before the use of antibiotics. This would also lead anyone to question that maybe it's not caused by a microbe after all. In another 2018 systematic review, the researchers write, the diagnosis of acute rheumatic fever is entirely clinical. Without any gold standard test, no treatments have been shown to reduce progression to heart disease. Prevention mainly relies on treatment of strep throat and using long-term antibiotics, but evidence for the effectiveness of either approach is not strong. Now, are antibiotics the cure and the preventative for progressing disease to your child's heart, right? Does it spread to the heart? Can we stop that from happening? I see comments like this all the time on my social media. Comments like, yeah, don't mess around with strep. This is the time to use antibiotics so it doesn't spread to the heart. You know, one parent to another. And they're very well intentioned, of course. But many parents think they are saving their kid from severe cardiac manifestations by giving them antibiotics if they have strep throat. You'll find when you casually look up why rheumatic fever has declined over the years in industrialized countries, you'll certainly see some claim it's due to the use of antibiotics, as I've mentioned. But take it from this review article that states the truth on this. The decline in death due to acute rheumatic fever and rheumatic heart disease in developed countries preceded the discovery of penicillin by a few decades and is mainly due to improved living conditions that followed economic prosperity. Let me read that bit again. The decline in death due to acute rheumatic fever came prior to the discovery of penicillin by a few decades. So what can this tell us? If it is in fact poor living conditions and low socioeconomic statuses that is strongly associated with damage to the heart valves and conduction issues and not the bacteria invading it, supposedly invading it, then what can that further point us to? Well, poor living conditions are also associated with poor nutrition, damp and dirty housing environments, exposure to toxic pollutants from unregulated practices in some of these countries, harsh child labor, poor hydration, bad air, bad water quality, stressful living situations, and many other factors. The researchers go on to write, despite the scarcity of data and its effectiveness, long-term injectable penicillin is widely still used in practice. There are gaps in our understanding of disease pathogenesis. Treatments for the disease are all based on low-quality evidence. Nevertheless, the burden has decreased over the past few decades, probably more as a result of socioeconomic development than control efforts. There, they said it. Now, let's take a look at this panel in the Lancet's Review article. They write, although several questions relating to acute rheumatic fever remain unanswered and merit focused research, there are only a small number of dedicated rheumatic fever and rheumatic heart disease researchers, and the funding available for rheumatic fever is small. Take a look deeper into this chart. With repeated admissions of not understanding the pathogenesis of the disease itself, there is not one word about the possibility that the cause of these issues may not be the germ itself. You'd think this would come up considering all the inconsistencies. The original premise is never questioned, as I often point to, regardless how little evidence they actually have for their model. They don't miss an opportunity to develop another vaccine though. Even though they stated above that they need more research in all of these areas, they wrote, quote, a large portion of the funding for acute rheumatic fever and heart disease research goes to vaccine development. Well, it makes sense to develop a vaccine for something you don't even understand, right? I'll let you be the judge of that. It may also not come as any surprise that one of the two authors of this publication holds a patent for a Group A strep vaccine that was due to enter clinical trials at the time this review was published. So there's that as well. So we can see that antibiotics really are not what's reducing the incidence of rheumatic heart disease. But can other allopathic treatments be somewhat helpful? What about anti-inflammatories to treat rheumatic heart disease, as they often are used? This article writes, reducing progression to heart disease, anti-inflammatory therapy for rheumatic fever has long been considered to have the greatest potential for reducing the risk of progression to rheumatic heart disease. 8 randomized controlled trials compared various steroids with aspirin, placebo, or no treatment. Overall, steroid therapy did not result in lower rates of valve disease. The results were similar even in severe carditis. They go on to write, there are no reliable data to support the use of anti-inflammatory drugs like aspirin, NSAIDs, corticosteroids, intravenous immune globulins in acute carditis. With regard to subsequent development of heart valve lesions and cardiac disease, they are not helpful as well. Thus, it appears that even steroids and other anti-inflammatories cannot reduce the risk of progressing to rheumatic heart disease like we've been told. Something else that comes up frequently in these papers is that the majority of people who end up with heart issues likely didn't even have a throat infection. As many as 75% of individuals who are diagnosed with acute rheumatic fever do not recall a throat infection in the last 3 months. Here we are again with a conundrum. Perhaps it's not that big bad bacteria. Perhaps it wasn't the sore throat that actually causes rheumatic fever or any progressed cardiac symptoms. Let's talk more about carditis, since this is the scariest symptom of this condition. If it's not the strep that's causing some reaction to the heart tissue itself, maybe there are other things contributing to heart issues and valve damage. According to conventional medicine, rheumatic fever can cause a pancarditis. That involves any layer of the heart. So it can involve the pericardium, the epicardium, myocardium, and the endocardium. While the carditis can affect different tissues, they claim that the mitral valve is almost always involved and the aortic valve is involved some of the time in reported cases. Rheumatic fever is also associated with congestive heart failure and pericardial effusion. These are the hallmark characteristics. So what else can contribute to these types of symptoms and signs? Let's take a look at what the Myocarditis Foundation has to say about what else can cause carditis. Straight from the horse's mouth. You can see their list here. And we can breeze over bacteria and fungus as any cause because we've already covered that extensively, and we see there's really no evidence that they are the cause of this. But what else do they point to as the cause? How about medications, toxins? They even include ticks, spiders, and other biting, stinging insects. These can contribute to the development of carditis. Let's talk about medications first. In a study published in the Journal of American College of Cardiology, researchers found that current users of Cipro, an antibiotic, face a 2.4 times greater risk of developing aortic and mitral valve regurgitation. Now recall that mitral valve regurgitation is associated with nearly 100% of the cases they call rheumatic heart disease, and that the aortic valves are associated much of the time as well. There are several issues with this class of antibiotics, namely mitral valve damage, but it's likely that this isn't the only class of antibiotics that can cause similar damage. How about this for a thought? What if the antibiotics that are handed out to sick kids with sore throats, or the ear infection, or the cold, damages their hearts and valves? Some of them. What if it's the drugs themselves that cause the issues? And what if the damage reaches such a point that they end up in the ER and they are told that they have rheumatic fever and then treated again with antibiotics and steroids? What if those that go on to develop cardiac issues are labeled as rheumatic heart disease and they were in fact harmed by the very antibiotics or drugs they were given for that strep throat or another issue in previous months prior? This is the very question that needs to be asked that most researchers nor physicians ever ask. However, I did find one medical doctor and researcher who does ask this type of very important common sense question. He referenced a study on staph infection causing an increased risk of heart attack. The paper claims that the staph infection is what directly causes the increased risk of heart attacks. His point is that the researchers didn't even consider that the treatment itself, that the antibiotics themselves could cause the heart attack, as this type of reaction to antibiotics is a well-known occurrence that can occur for some patients. It's a syndrome that arises due to a wide variety of drugs, including antibiotics, especially penicillin and cephalosporins, which, by the way, both are used to treat strep throat. So the doc goes on to write, as such, the cardiac event following staph bloodstream infection may be a result of the antibiotics used for treatment and not the infection per se. That's what he said. So it could in fact be a contributing factor that the drugs and the antibiotics themselves are contributing to damage to children's hearts. Now, what about other drugs? Overall, we identify 62 drugs associated with myocarditis, 41 of which are categorized into 5 main classes. Of those include antipsychotics, aspirin, chemotherapy drugs, and even vaccines made the list. I know I'm not allowed to say that word here, but they said it. But I want to dig further into this vaccine as a contributor to carditis in these reviews. Vaccines have been correlated with carditis for a long time, long before recent years. It's been something that isn't really reported on in the mainstream, of course, but it is a thing. And as we know, for this to show up in the research at all, it must be happening to a larger degree than's reported. When it comes to vaccines, pharma's most profitable product, where there's one rat, there's likely 100 more hiding somewhere. So take a look at this paper. Smallpox vaccine had almost 7.5 times higher incidence of myopericarditis in the 30 days post-vaccination than the non-vaccinated military personnel. In another study, they found that immunization may induce myocardial complications, and in 3% of the study population, evidence of post-vaccine myocarditis was noticed based on the EKG patterns. So we can see that in some cases, vaccines like the mumps vaccine, polio, tetanus, smallpox, diphtheria, and others can definitely affect the heart in some people. Perhaps these can also contribute to the damage to the hearts of children and predispose them to further heart disease later, such as rheumatic heart disease. Now, am I saying that vaccines are the cause of the condition we call rheumatic heart disease? No, of course not, I'm not. But what I'm saying is that there are several other factors that can lead to damage of the heart tissues and to the heart valves. And perhaps those go undiagnosed before a patient shows up with more severe complications and then gets told that, oh, it's because you had a strep infection and now your heart's damaged because it spread to your heart. So we covered a few drugs that can cause carditis, but what about back to the biting insects and venomous animals? It really is no surprise, as this has been documented in many cases in literature with poisonous spiders and poisonous ticks and snakes and these types of insects causing heart damage or even heart blocks. I discuss this a lot when I talk about Lyme disease. But these bugs and animals definitely can cause major damage to the heart tissues, especially in compromised individuals. Of course, the risk is higher for people who are impoverished and more poorly constructed houses and more exposed to less developed environments. Venom from insects and animals have been associated with cardiac manifestations for a really long time. We see heart failure and valve damage after certain bites. As this review points out, neurological complications vary according to the offending animal and are often directly related to the toxic effects of venom, affecting the central nervous system, the neuromuscular transmission, the cardiovascular system. So could it be that certain people have damaged heart tissue due to multiple other reasons long before they end up as a statistic and labeled as a rheumatic heart disease patient? Okay, in closing, as we've covered in great detail, the condition called rheumatic fever and rheumatic heart disease is associated with poverty, and it's nearly non-existent in the Western world. So here we are again, trying to find the ghost of germ theory, trying to find some evidence to support this idea that germs cause these diseases. But all we seem to find are claims without much of anything of substance to support it. So what puts children at risk? What do you really need to be worried about if you have children? What would put your child at risk for heart valve issues and heart failure that is associated with rheumatic heart disease? Well, poverty, malnutrition, poor living conditions, toxic environments, stressful living circumstances, congenital heart disease, so heart disease that a child is born with, drugs and pharmaceuticals like we covered, vaccines, biting insects that have venom like ticks, spiders, and snakes, scorpion bites. There you have it. Those are just a few of what can contribute to why a person would develop valve lesions or heart disease that we call rheumatic heart disease. So it doesn't appear that rheumatic fever or rheumatic heart disease is caused by bacteria. For parents that are still giving their children antibiotics to prevent it, they're afraid for it to spread to the heart. I'm not so sure this is doing any good, and I actually think it contributes to much harm. Just like that 2018 review I shared at the beginning of this video, among populations safeguarded by high standards of living, rheumatic heart disease rates are virtually zero. Intravenous, God. Okay, Steph.